The SDG agenda for 2030, I think, represents what Barbados has signed on to in respect to health care for the future. Whereas the MDGs served us well, and indeed some countries may not have completed every one of the MDGs, I don't think we need worry about that too much. We need now to engage in what is, to my mind, a whole of country or all of society approach towards healthcare. So although we continue to measure our basic healthcare barometers, we still have to engage now in reaching out to other parts of the society, the question of violence, the question of families, the question of education, exercise, trade, because we've got to start dealing with the imports that we bring into our countries, especially for food. If we're going to move to a nutrition-based fight against NCDs, we need therefore to incorporate all of these agencies, especially trade, into our future agenda. WHO reform is what is engaging a lot of the technical time. But for me, as Minister of Health, and something to take away back home to Barbados, it must be our continued approach towards the NCD, non-communicable disease battle. Non-communicable diseases accounts for a significant part of our annual healthcare budget. We need, therefore, to work around all aspects of it. We have to recognize, of course, that funding may not be as available as it would have been many years ago, and indeed a number of our countries are being asked to look within our own funding programs and create that space by being more efficient and create that space so that there is money available to continue to improve our services to the people. We have certainly in Barbados been looking at the whole question of healthcare financing, a modern approach to healthcare financing, and what levels of cooperation, what efficiencies, as I said, we can bring to the system so as to improve the healthcare offering and to keep it modern and to keep it effective. After all, healthcare access, healthcare coverage, and healthcare financing. We don't want people when they access healthcare to find themselves penniless. I think a lot of the elderly in our world today are facing that challenge, and this is one of the very important factors we're looking at. But certainly I think the practices which we want to share has been our achievements in terms of communicable diseases and our recent experiences, which everyone here has been repeating, that we can never close our eyes to communicable diseases. They can come back, they can reemerge in different forms. We are now in the throes of our battle with the Zika virus. We know about dengue, we know about chikungunya, and many other diseases. The countries of Africa especially have been speaking to the question of yellow fever. So we have to be constantly aware of a theme that the ground we covered is still ground that we need to keep covered. And we need to have our funding in place and our programs in place to maintain these basic health requirements for our people.